Follicular unit extraction is a surgical procedure where individual follicles are taken from the scalp. Now, in our scalp, we have something called temporary hair and permanent hair. The temporary hair, if you will, is hair that's sensitive to hormones, mainly testosterone. Most often in men, it's the temporal hair, the frontal hair, and the crown. This hair, in many people, mainly because of genetics and hormones, can go away. The procedure, or a procedure to help this, is called FUE, follicular unit extraction. In that procedure, what you do is you take hair that's genetically programmed to be there forever, which is the hair in the back over here, and you take those follicles. Now, you're not taking hairs, you're taking follicles. Each follicle can have from 1 to 6 hairs. So you take thousands of follicles from the back and move them to the front. One question people ask me is, well, why won't that hair fall out like the front hair would have anyway? Well, hair has this really cool property called donor dominance. What that means is when you take a follicle from one part of the body and you move it somewhere else, it's still going to act like where it came from. So with FUE, the advantages is you take out individual follicles, there's no thick scar. The disadvantage is you have to shave the donor area, typically. Now, you can do the donor area without shaving, but it becomes more complex. There can be a higher rate of transaction and the cost is almost double. So you shave the donor area, and for some people they don't want that, but for those that don't mind, it gives you an operation with no scars. If you want a buzz cut or short hair down the road, you can always do that. The follicles are removed individually, they are treated, and then they are reimplanted into the donor area. Now, when you do FUE, it's important to note that doing a hair transplant, in my opinion, is sort of like getting a filling in your tooth. Now, when you get that filling or that follicle is permanent, right? But you have to maintain the tooth or the hair around it. So I tell my patients this. Yes, the transplant will help. Yes, it's going to give you more hair. But if you really want the best results from a FUE, hair transplant, follicular unit extraction, it's important that you do some kind of lifelong maintenance. Now, a lot of guys don't like hearing that, but that's the truth. If you do lifelong maintenance, you're going to have the best results. In our next video, I'll talk to you all about what lifelong maintenance is.